Hi everyone, my name is Megan Malone and my special topic is sudden infant death syndrome, commonly known as SIDS, and how and why it disproportionately affects African Americans. Some general background knowledge on SIDS is that it mainly happens between 2 and 4 months of age, and primarily under 6 months of age. SIDS happens quickly and it usually happens overnight while the child is sleeping. Due to how fast it happens, there are no signs of suffering for the infant. One of the main contributors of SIDS is sleeping conditions. I will be talking about this more throughout the video, but displayed here in the photo is the correct sleeping position for an infant. There are many imperative statistics that draw attention to how much SIDS is an issue that affects African Americans more than it should. Overall, African Americans are twice as likely than the white population to die from SIDS. One shocking statistic is according to authors Tanavy and Hawk, mortality rate due to SIDS was 83% higher, 73.3 deaths per 100,000 live births in non-Hispanic Black infants compared to non-Hispanic white infants. Their predisposing characteristic of race is one of the factors contributing to SIDS in general, as well as their race being a factor that is contributing to their socioeconomic status, which affects their insurance status and if they have access to health care. One of the direct ways race affects SIDS for the African American population is a gene mutation that approximately 1 in 10, or some say 13%, of African Americans have. This gene mutation is S1103Y, which affects the cardiac sodium channel. Due to this, there is a 24% increased risk of ventricular arrhythmia in infants. Ventricular arrhythmia causes the lower chambers of the heart to beat very fast, which is tachycardia. Therefore, oxygenated blood is not being sent to the brain and the rest of the body. This is how SIDS would occur due to a genetic predisposition. African Americans are more likely to have public health insurance coverage, such as Medicaid, than whites. Henceforth, their socioeconomic status is lower overall than the white population. It has been concluded that families with low socioeconomic status may not have adequate education about infant sleeping position. This is the main contributor to SIDS, so this is important. Additionally, 1 out of 3 infant mortalities are from families with low socioeconomic status. Therefore, there is a strong relationship between race, socioeconomic status, and SIDS. Sudden infant death syndrome occurrences are directly related to parental smoking and infant sleeping position. Without proper care and preventive measures such as education on proper infant sleeping position, change will not be made and the African American population will still be vulnerable to SIDS more than others. Even though part of the vulnerability stems from genealogy, other reasons such as race, education status, and socioeconomic status still have a huge effect on SIDS. African Americans do not always receive the quality of care necessary to change their habits. An example of a positive public health intervention in which education and proper care was implemented is when enhanced messages are provided to African American families. These messages include the dangers of incorrect sleeping position and soft bedding, and instead they advocated the messages seen in the photo here. In a controlled study, these aspects of infants sleeping on their stomachs or with soft bedding were explained in detail on how they can lead to suffocation of an infant, and the study revealed that it reduced improper sleeping methods that could lead to SIDS. Another factor that can affect SIDS is access to care. Access to care can be limited for the African American population since they are more likely to have public insurance such as Medicaid. Under Medicaid, physician's choice and availability may be limited. Therefore, a new parent may not receive proper education from a pediatrician that they need in order to decrease the risk of SIDS for their newborn. From a population level, public health interventions have taken place due to high number of SIDS cases in minority populations. An example of an educational intervention was the Back to Sleep campaign, a program that the government launched in order to spread awareness that infants should be sleeping on their backs and not their stomachs. From an individual level, a family that has lost their infant to SIDS can face a wide array of physical, social, and mental problems. Taking time off of work due to the death of their infant can be financially stressful for a family. Additionally, they may be stigmatized from other people, believing it is their fault that this happened. Lastly, depression and other mental illness can occur to the parents who lost their infants to SIDS. The two questions that I have proposed for you are: what alternative would you suggest for a public health intervention that addresses SIDS for all minorities, but specifically African Americans? My second question is: how would you solve lack of quality care for minorities due to public health insurance?